guys, welcome to another episode of Ask Nurse Vicky. How are you doing? I hope you have been enjoying the episode we have been putting out so far. And if there is anything you would like us to share about, please do not hesitate to let us know. You can leave that in the comment. So in this episode, I just want to share few signs, early signs of Alzheimer's disease. This is one of the disease that is common and people have to deal with, or you have to help a loved one, either mom, dad, or grandparents that have Alzheimer's disease. Help them, with the quality of their life. So, when we talk about Alzheimer's disease, what it is a specific brain disease. It is a specific brain disease that is progressive in nature and as well degenerative in nature. So that means the symptoms progresses. Everything is not going to happen the same time, but you will see it progressing, from year to year. It begins, the symptoms become more evident. And all these symptoms doesn't mean they're going to happen to everyone the same way. So everyone is going to manifest differently. All right. So I just want to share five early signs that somebody might have Alzheimer's disease. And mind you, Alzheimer's disease has to be diagnosed by a doctor, a medical doctor. Sometimes some primary care physician can do that, but most of the time they defer to a neurologist. When some of these signs are becoming more evident, they will refer you to see a neurologist to do additional testing and be able to come up with the diagnosis. So here are five early signs or five signs that you might want to watch out for if you're living with someone who is older. And also note that Alzheimer's disease, it is not part of aging process. So it doesn't mean that automatically as you age, you're gonna have it. All right. But it tends to be more common among older people. It doesn't mean everyone is gonna get it. All right. People who are more at risk are people in their 60, 65, and above that tends to have it, but it doesn't mean that everyone is going to have it. All right, so the first sign is memory loss. We call it impaired memory. Your brain is the part of our organ that pretty much control a lot of processes with our body. So if that part of the brain is affected, now people begin to have what is called memory loss, impaired memory. And these most of the time affect short term memory, meaning that people can still remember things that happened decades ago, but things that recently happened, things that probably happened this morning, happened yesterday, happened last week, happened last month, they may not be able to remember those simple events, those short term events, things that recently happened. They may not be able to remember. They may not be able to remember that they went to church last week. They may not be able to remember that, oh, we saw the doctor last week. They may not be able to remember that these happened last month. Simple things. So memory loss, remembering things that recently happened. So another things, another symptoms, sign of people with Alzheimer's disease is misplacing things. Misplacing things. I'm not talking about misplacing things or any of these signs. A single event doesn't diagnose someone to have Alzheimer's, all right? Because, of course, sometimes when you're under stress, you do forget things. You do misplace your car key or you put your bag somewhere else or your phone. Those are isolated events. But when it now becomes a pattern, they take something from the kitchen to put in the room, they don't remember that, oh, I did this. They don't remember it yesterday. The same thing event happened today again. It becomes a pattern that when they take things, maybe taking things from the microwave to put it somewhere, they forget. Oh, it's like, where did I put my food? They forget, you just put the food in the microwave. You know, Misplacing things, taking book from here, putting it somewhere else, and don't have a clue that they've done that. So that can be an early sign. Another one is, forgetting familiar faces. Familiar faces, especially people who are close to them. I have walked into a family, and the husband that have Alzheimer's cannot even recognize that the woman next to him is the wife. They have been married for over 30 years, and he cannot remember this is my wife. I mean, that can hurt. So people with Alzheimer's, they may not remember familiar faces. They may not remember this is my grandson, this is my granddaughter. This is my daughter that just came back from school. They may be asking you, who are you? They may not remember. And like I said, all this, someone may not manifest all these signs, but you will see like a trend in them forgetting things. Even if they live with you, they might forget that you are the daughter or you are the son. They might forget that. So another thing is, forgetting similar objects, forgetting similar object, how to use simple things, forgetting how to turn on the TV, for example. These are the things that they do all the time, familiar tasks, simple things. All of a sudden, they don't know, how do we turn on the TV again? Even when you're giving them the remote, okay, which button should I press here? Forgetting things like that. Forgetting maybe how to use the microwave. Forgetting how to fold clothes, do laundry. Forgetting how to turn on the stove, how to open and lock the door. No simple tasks that are very familiar, things that you don't think about, that you just do. Now it's becoming more challenging for them. Or forgetting to eat. They can forget to eat, put the food on the table. They don't remember that, oh, I haven't had lunch. Sometimes you have to call them and maybe put a sign somewhere that, have you eaten? So simple things like that, familiar tasks like that, they forget. And last but not the least, this is not a conclusive list, but the last but not the least is, repetitive actions or repetitive questionings or repetitive statements. So they may be doing same things over and over and over again. For example, if they are folding clothes, they can be folding that one cloth over and over again. Keep folding, they pull it apart, fold again. They can be doing the same thing over and over again, or asking you the same questions. I have been to homes, and they keep asking, who are you again? Then 2 minutes later, who do you say you're with again? 5 minutes later, what is your name again? So they keep asking you that same questions that you keep answering them. It's not that you didn't answer them the last time, but they've forgotten who you are. They keep asking you again, or they keep saying things again over and over, non-stops. So these are just some signs. All right. So if you have someone, manifesting any of these symptoms, what you can do for them is to get them seen, evaluated by their primary care doctor. And the primary care doctor, I can guarantee you, most of the time, if not 100% of the time, they will refer you to a neurologist if they are concerned. But if it's still kind of something that is mild, they might be able to prescribe medication, Namenda, things like that. And these medications, all right, these medications doesn't mean that it's going to cure the disease. It is just probably going to slow down the progression of the disease. Instead of happening faster, it kind of slows it down, and also sometimes help with memory loss, help them to remember things. They will still forget things, but it kind of like help them. But it does not cure the disease. Know that the disease is progressive, and over time different symptoms are going to be manifesting. Over time it might become behavioral, that you see behavior coming into play to this. But here are just a few early signs. If you notice in any of these signs, let your loved one be checked. Let the person be seen by a doctor. And if you need help, if you want us to just come and do a basic the mental status exam, we can do that for you. But mind you, we cannot diagnose. We can just give you information, but you will still need to see a specialist or the primary care doctor to be able to make a final diagnosis. So let us know if there's any way we can be of help to you at Petra Home Care. Please reach out to us. Our number is 713-320-9619, or send us an email, info@petrahomecare.com. My name is Victoria Showumi, and I'm a registered nurse. And if you haven't subscribed to this channel, please do so. Subscribe, like, leave a comment, and help us share. Until I see you again, this is Victoria. God bless. Have a wonderful one. Bye for now.